Webster technique is to do the heel to buttock check. So we're going to bring a patient's legs up here. We're going to check for resistance on one side versus the other. And if you can see that, you can see her left side is showing a lot more resistance. And that is the side that she's having a lot of pain down right now. That would indicate that she's got a sacral base posterior on the left. Often with that, if you remember from our video on sacral motion, it can go, the apex can be torqued to the left as well. So then I come up and I palpate which side that goes to. So I'm just going to palpate a little bit here. Pretty tender down there.
All of that hurts.
Yeah. And I can feel that the apex is to the left. And that she's also got a PI ilium or an extension restriction on this right side. So the next part, we did the sacral analysis. Now we're going to do the adjustment for the sacrum. And I really like the Thompson AI with the torque drop technique. I think that's really beneficial for moms. So that's what we're going to do today. I'm actually going to slide down just a tiny tiny bit.
Yep.
Are you okay there?
Is that good? Yeah.
To set both drops on my table. So I'm going to set the drops pretty light. And since it's her left side that's up, I'm going to stand actually opposite. And I'm going to take my superior hand on the sacral base, which is about the S2 area. And I'm going to take my inferior hand and cup on the lateral part of her sacral apex. And the idea with this one is I'm going to do a little bit of torque back midline with a P to A thrust. Feel okay?
Yeah.
I'm going to do it one more time. I'm going to lighten it up just a teeny tiny bit. It sounded extra loud today.
It felt great.
Felt good?
Yeah.
Awesome. I love this move. Good. And recheck that Webster technique. Or Webster. Okay, let's recheck heel to buttock here. And we do have an improvement there. Now I do want to clear out this PI ilium, so I'm just going to take care of that real quick. Yeah, you needed this.
Mm-hmm.
That was good. So that moved well. I'm not going to thrust again. So while she's here, I'm going to show you just a little bit about piriformis work and just some easy things for you to do here. You can do what they call a piriformis sweep, which is just taking kind of the palms of your hand and coming down across your piriformis. Kind of do a little massage there. I like to get in a little bit deeper. I think it's a little more effective.
Feels better.
Oh,
yeah.
Hers are tight on both sides, more here on the right, so I'm going to just show you what we're going to do here. So I do kind of a pin and stretch kind of motion through the hip. So I'm going to take either a thumb contact right in the piriformis, or you can take and do like a little piezoform contact, or part of your thumb thenar contact. I think you like the thumb, don't you? She likes the thumb, so we're going to do the thumb contact on her. So I'm going to find that and kind of pin it down, and I'm going to move her leg in and out. Now be careful with this if they do have pubic symphysis pain, that you're not going too far out. You feel stretch?
Mm-hmm.
Yeah. So this is not part of Webster, but it is a nice thing to kind of add as a complement to it. Just for balance purposes, we're going to do this side too. You can use both. Yeah, this side moves a lot better.
A little worse when you go out to the...
More on the out?
Yeah.
up, and we're gonna go onto your back. So I'll take the pillows out. Doing okay?
All right.
All right. Go ahead and lay on your back. There I got the pillow for you.
Thank you.
There you go. And so if we go by true Webster, you can see baby
I
shifted
know.
all over
I
to the
know.
right.
I don't want to talk about it.
So with Webster technique, if you follow and go by what usually happens is if you've got a left base posterior, often you're going to see a right tight round ligament. So it's going to be opposite. That's typical pattern. It doesn't always flow that way, but most of the time it does. And you can see here that baby is sitting a lot more on this right side. So
Sure is.
we are going to work on that. So to find the round ligament, we're going to go belly button about 45 degrees inferior and lateral. And then we're going to find the ASIS and go about 45 degrees from medial to inferior. Where they cross is about where you're going to contact. But it's a really easy place to find, especially when they're this far along in pregnancy. Because it's about where the belly rounds is a good spot for that. So I'm just going to palpate for some resistance, and I know you guys can't see it on your angle here in the video, but I can definitely feel more resistance on this right side. So we're just going to take a light contact, and I'm just going to palpate to see where I'm finding most of the tension. So I can palpate kind of up along the side here, kind of down a little bit closer to pubic symphysis if I need to, and then I'm going to apply a light pressure towards the opposite shoulder.
This right side was also my C-section scar. The right side always had more issues than the left
I wonder
with
if
scar
that's
tissue,
why.
so it might, it's just a
Theory.
that this might be my pattern because of some of that. Yeah.
Here's a good spot. Let's work on it. So we're just gonna hold that. You've been pretty active.
I think he's been moving, he's mostly head down, but every once in a while he'll just like go transverse for a little while,
Okay.
which is super comfortable.
Because it feels like he's wrapping around your entire body.
Yeah, yeah. But most of the time his butt is sitting like right in this rib cage, so yeah, he's been a gem.
Hard to breathe, huh?
Yeah, just a little bit. That's a good one.
Yeah, that's tight. So I'm just working up along the round ligament. She's got some multiple places that are tight on her today, so we're gonna work through those. Not as tight down low, but you're tight up on the side. Okay, so decreased quite a bit there. Good. So that is Webster technique. Now I'm going to walk you through, I add a psoas stretch into my kind of pattern. I think it's really helpful, especially when we got moms with that anterior pelvic tilt. We've got a lot of extra weight around the middle that's pulling on our psoas and hip flexors and different things. And so just kind of working through relaxing those muscles kind of helps mom's low back and different things. So I'm going to show you kind of how I work through that really easily with a pregnant mom. So, and I'm going to do both sides. You don't have to, but hers are both really tight.
But please do.
But please do. Yeah, hers are both really tight. So what I'm going to do is I'm going to take my thumb, and there's a couple different contact points you can do with this. I tend to go kind of over the tendon right in where the hip is. You'll feel that ropey fiber there. You can also come up above the ASIS and just kind of put your thumb in there. Don't go too deep on that because we do have a baby underneath there. So it's just not as comfortable there, and I feel like I can work better down in the hip. But those are some couple of different options for you there. So I'm just going to bend leg up here. I'm just going to work. So this helps to release the psoas, but it also helps with the posterior hip muscles as well. Ooh! So I come across. I really like that one.
That's disgusting.
Can't say I've ever had that response.
Well, you got me on a good day.
Good. Oh, yeah, that one is tight.
And I can feel it all posterior.
Yep.
When you do that. Yeah.
That's why we cannot ignore the psoas.
Yep.
Okay, good. That was fun. Let's go the other side.
I'm gonna break out in a sweat. It's fine. Everything's fine.
I'm glad you wore a tank top.
Yeah.
Let's balance you out. It's just for fun. I wanted to make you feel better.
Thank you.
Yeah. It's tight too.
Yeah.
Not as bad, but.
No, but I feel it right in that same sacrum spot that was bugging me.
Doing okay?
Yeah.
Okay, so let's check pubic symphysis while we're here.
Okay.
So I find the easiest way to find pubic symphysis is to have you put your thumbs in your belly button and bring your fingers down, and where middle finger touches is the top.
My belly is too large. It's there. I found it.
So most of the time the pubic symphysis is going to go superior on the same side as the tight round ligament, or the same side as your PI ilium. Remember from the animation videos where we kind of showed the pattern of that. So what I'm feeling for is for tenderness and for it to be a little bit more superior. Sometimes you might feel it a little more lateral if they do have maybe a little bit more separation, but you're not having as much pubic symphysis pain. So most women are okay palpating, just, explain what you're doing, where you're going to palpate. And I'm going to palpate right down over your pubic bone here. I'm going to use my thumbs and just see if there's any tenderness there. And her right side is just a little bit superior here. So we are going to do an adjustment on her. We're going to use the drop table on her pubic symphysis. So I'm actually going to let you take that out. This might be kind of hard to see, but we're going to slide down just a teeny tiny bit. 40 feet up, right there. I'm going to set the drop pretty light on this, and I'm only going to thrust one time. That's all you get.
Thanks.
Because it can be pretty tender. Most of the time it just feels like a little bee sting. So I'm going to do is put, whoops, that's too light. I'm going to put the pubic symphysis right kind of in the middle of my palm there. I'm going to do an S to I adjustment. So I'm going to actually stand up above and go down. Okay. Are you ready? Okay. I'm going to stand a little bit to the side so they can kind of see what I'm doing here.
Got this leg straight.
Yeah, let's straighten that leg if you can for just a minute. Whoops.
Nope, that did it.
That did it?
Yep.
That was enough? Okay.
Yep.
I'll recheck it. It doesn't take a lot usually.
It does. It feels just like a little sting, but that, yeah.
All right. And then let's show them how to get up properly. If you want to turn and go this way so they can see on the video. So we're going to have our patient turn on their side. Legs are going to swing down. They're going to push up with that arm, and they're up, and keep everything nice and together. All right. Thank you.